Good morning.
Good morning.
Sorry, we are jumping from one meeting to another, so Melissa will pop over here in just a minute. Virtually jumping. So.
No problem. I have to log off at like 9:50, but I can try to vote and help with the quorum ahead of time if you need. Sorry, I'm taking like an 8-week kind of workshop and it just hits in a certain time, so.
I think that's all right.
Yeah.
Hello, Melissa. I told them we're virtually hopping today.
The old Zoom two-step, huh?
Yeah.
Yeah. That's what I'll have to do in a few
There we
minutes.
Okay.
Unfortunately, this whole situation has made us much more efficient. So there's no time in between meetings at all. So.
I don't know if I'm going to look forward to having to get in my car and driving in between meetings. I don't know what I think about that. And, anyway, it's an interesting world to contemplate what we might be evolving to on a regular basis.
I like the time to be able to process. So like when you get out of the meeting, you have like 15 to 20 minutes to process before you step into another one. Yeah.
Hi, y'all. Sorry, I was having some technical difficulties logging on there for a moment. Did you guys already call it to order?
No.
Okay. So we'll go ahead and call to order at 9:33. We do have a quorum. And then you guys did receive the agenda and the minutes from Melissa. So we'll start with the agenda approval. Does anybody have anything they'd like to add to the agenda? Okay, can I get a motion to approve the agenda?
Sharon Brown, I move that we approve the agenda.
In a second?
Kristen
Bill,
Amundson, second. Oh,
Okay, thanks.
sorry, Bill.
That's okay.
All those in favor?
Aye.
Aye.
Any opposed? Okay, and then she sent out the minutes from our January meeting. Are there any updates to the minutes? Okay, do I have a motion to approve the minutes?
Sharon Brown, so move.
In a second?
Phil Van Horn, second.
Thanks, Phil. And all those in favor?
Aye.
Aye.
Okay, any opposed? Okay. Does anybody have any public comments that aren't on the agenda?
Laura, are you planning on talking about our excitement with the vaccine line under number 7?
Yeah, I was just gonna touch on it during my time.
Okay.
I'll wait.
We have no new membership appointments this meeting. And Joe was going to give us a little bit of just his background on being a citizen at large on MCC. So Joe, we'll let you talk about your experience. And Joe, if you're talking, we can't hear you. I think Joe might be experiencing a little technical difficulty, so we're gonna let him off the hook for giving us that background today. And I'm just gonna turn it over to Laura for all her updates.
Oh, so I guess I'm the guest of honor today because I have a list. So a couple of things. Jody, Melissa, myself have been in a ton of meetings about vaccinations and trying to get people to vaccinations, how to identify people that need vaccinations. And so we've been pretty pressured to put together some standard language for call centers to be able to communicate to a caller if they have any transportation needs, communicate to them what the options are. And so Invita has put together, along with Silver Key and Fountain Valley, a vaccination hotline for transportation assistance. My computer says I'm playing music. Do y'all hear music on there? Okay, I hope not. Okay. So we put together some standard language to send out to the health department, who's going to send that out to the call centers like UC Health, Kaiser, so on and so forth, to start asking a unique question. And basically that question is, do you need transportation assistance to get to your vaccination appointment? And if that's answered yes, we put up there a couple of options that's available, and these are the public options that are available. And one of the options is working with Mountain Metro. If it's somebody that can use fixed route or is already signed up for paratransit services, then they can utilize that. Or if they're paratransit, they need to go through Mountain Metro if they're already a customer. So that's one. Option two is the hotline that the three have put together. And I can send out that standard communication. But if there's any others that are on the call that are operating and helping out with getting people to vaccination appointments, I'd like to know what you're doing and how you're connecting with the providers, because it is something that if we can better coordinate that communication to the call centers and the providers of vaccines, then there's less confusion amongst them. We're just now kind of making contact with them to get a more coordinated effort around transportation. And it's been a little bit difficult. I've been amazed how confused the health department can get. And part of that is just because they are just not connected with our group as well. They're getting more connected, but not connected with our group as well as they could. So I'm trying to be sort of the conduit between you guys as providers and the health department, so they're able to coordinate with one person instead of multiple people. And I'll be reaching out to you guys once I know what everybody else is doing. I know what the three are doing, and I know what Mountain Metro is doing, but if Goodwill, Kristen is doing any kind of the health department, or if there's opportunities that maybe you're not plugged in yet in helping out with those efforts, let me know what you could do. And we'll figure out how to work within the group to best communicate those efforts, as well as simplify the message. I think that's been super important. Simplify the message for the health department. So that's where we are with that. There has been some vaccination events that I know that different entities like UC Health and Centura have been working with specific providers on, and we're still, advocating for that. If it's something that it's a special event that they have already a connection. So I know that for Fountain Valley, they had a connection with, I believe, the health department to do a vaccination, big day of vaccinations at their facility. They're working directly with that provider, and we still encourage that. I have put out to the health department as a part of the standard language that if they do have a big event coming up, to contact me so that I can better work with you guys to make for sure we're serving those events as well as possible. So a lot of moving parts, and I know Jody has been working with the health department on identifying homebound seniors and trying to make for sure that we are connecting vaccination people from the health department with those homebound seniors. I know that the health department has been working directly with some of you guys to identify those seniors, and that's still further developing. So their hope is that they can identify these seniors, go to the seniors' homes, vaccinate them, and then, continue to do that until we hit all the homebound seniors in the community. So just got off our direct service team meeting call. We're also advocating, if they are working with homebound seniors, to vaccinate the caregiver as well, because there's kind of this why not situation, specifically if the caregiver is having to isolate themselves, just to make for sure that they are keeping that person safe. So a lot of moving parts in terms of that. Does anybody have any questions, comments?
Diana from Teller, her audio doesn't work, and she put in the chat, Teller Senior Coalition is providing transportation in Teller County for vaccinations, and they're advertising in the local paper, newsletter, and contacting the vaccine centers. I will say, Laura, big thank you from the three of us for helping navigate and send a consistent message to all agencies throughout the region, because one person says one thing and then we get 900 calls because it's not true. So thank you for helping with the consistent messaging. And I just want to give a huge shout out to Peak Vista, even though they're not on this call. One thing Peak Vista has done for the specialized transit providers, and Jacob, you may want to look into this for Mountain Metro's drivers, is when we are providing transportation to the vaccine clinics or helping them sign up the seniors, then when you open a package of vaccine, you have 4 to 6 hours, depending on which vaccine it is. And so for any of the no-show appointments, they then allow our drivers and staff to use what would be considered wasted vaccine. So we are starting to get our staff, because even though we're all 1B, I think we're 1.B.Z78 for our drivers, the way this is going, which is so ironic because our drivers spend more than 15 minutes in an enclosed vehicle, and doctors don't even spend 15 minutes with patients right now. So they just kind of forgot, because we're such a small population. But if your agencies do assist in taking people to vaccines, that's your in for getting vaccines for your staff. It is kind of a cluster to get it done though, because since it's for no-show appointments, they call and say, like, you have 3 slots, but you have to be here in 10 minutes. So it's definitely a standby, but in the world we're operating in and how hard it's been to get our drivers vaccinated, I'll take any standby appointment that they have. So that is one great way of getting in your under 65 drivers.
Hey, Jolene, that sounds great. Could you send me your contact information for that?
So it's not a specific person. It's just whenever you're driving, like, so say Metro Mobility has an appointment to take somebody for a vaccine, then call that actual location that's doing the vaccine and say, hey, we're bringing this person down. Do you by any chance have a slot, or can we go on standby for that? So it's not a specific contact, it's for each event. And just Mountain Metro as a whole can call, like I would call the big, like we work with Peak Vista in Fountain, and you're not going to really be taking people to that one. So I would call a Peak Vista in Colorado Springs and ask them if you can go on their like list of no-show appointments, and then just stress, like, you know, you're disabled and senior drivers, like your drivers are in contact with seniors, and so you're doing it to protect the seniors.
That sounds great. Thank you.
You're welcome. It's the only inn any of us have been able to, like, you know, get in there at. And so I just wanted, because Craig had sent me your guys' numbers of drivers, and every time I try and, you know, get all MCC drivers vaccinated, I'm just hitting brick walls everywhere I call. So that's your way in. And Melissa also said to give her a call. She might be able to help you get a direct contact at Peak Vista for the Springs region.
Yeah, Jacob, we have several contacts with Peak Vista, and we can just hit up the people that we know so far. So yeah, we can hit them up. I think did Silver Key, okay, Erica's on there. Did Silver Key, did y'all get most of your drivers taken care of?
Erica posted in the chat that
Okay.
they've been fantastic in getting their drivers vaccinated. And I know they vaccinated in Vida this weekend too.
Yeah, I will caution the second vaccination. I think Jolene said this a couple of months ago. The second vaccination can kind of knock somebody out. It knocked my husband out, and he's a healthy guy. But making for sure that you stagger those, because you may have a driver that's out dealing with just sort of the aftermath of that vaccine. It usually, the chills and stuff that come with it usually last about 10 hours. So just be aware of that. I wouldn't want to vaccinate everybody at one time.
And if Peak Vista gives you the first one, whoever's giving you the first vaccine is then obligated to give you a second vaccine. So it's not like your second vaccine, you have to go on the standby list again. So if you can get that first slot, you're golden.
Awesome. Like I said, if you have any specific things that you would like to do around helping out with vaccination assistance, you haven't been plugged yet by anybody, please reach out to me, because there are opportunities to help. So we can kind of work within the group that's already helping to figure out how to best coordinate that. Switching gears, just to talk to you guys a little bit about 5310. We have established contracts with the current providers that was working with MMT. And we are going to be launching our full call for projects for the traditional 5310 program in March. So early March, you guys will be getting an RFP, a notification of an RFP, or a NOFA, however you want to call it. CDOT, everybody calls it something different. But y'all will get a notification for that. And the goal is to have contracts in place for the full 5310 program by July 1st. So everybody will have an extensive amount of time to prepare their RFP. You know, it will, those of you who have been through a AAA RFP process, you know that it takes some time on our end too, because it has to go through committees. So I think I know I sent out to the MCC the program management plan. And further down in the program management plan, it actually lists the steps that we go through. Posted soon. So those that are interested in 5310, obviously we have current providers that are working with that program, but it is open. It is an open RFP process. We also have some opportunities potentially coming with more CARES Act funding. So I'll keep the group apprised of that. We already have, and Diana probably knows about this more than I, CDOT received quite a bit of funding through the second CARES Act. And so that funding is being distributed by them through the rural community, so the 5311 program. We are receiving a small amount of funding just for the 5310 program. It's called CRISA. And so we're working with FTA to kind of figure out how to distribute those funds to our 5310 partners. It's a little bit different of a funding stream. So the CRISA funding is actually for, it can date back to January 2020. So it's basically any kind of lost revenue that went towards the activity sets of specialized transportation within the urbanized area. So if you were having to pay for something that otherwise would have been covered under, when you have your full program at full capacity going, then those are the kind of expenses that could be covered under CRISA funding. So just kind of, I'm trying to keep everybody updated on those things. There may, like I said, there is probably another way of CARES Act funding for transportation that will be coming to our area. And each one of these grants has different nuances. So some of these grants may be open just to the 5310 subrecipients. Some of these grants may allow us to have a broader base of being able to serve multiple agencies. Because we not only have the money coming through the MPO, which Metropolitan Planning Organization, we have money coming, CARES Act funding coming through the MPO for transportation, but we also have CARES Act funding that's coming through the AAA that can also be used for transportation efforts. So a lot of funding coming our way, not necessarily for sure when, where, how, and what it can be used for, but I'll make for sure that everybody here has the information needed on that.
Thank you, Laura. Who knew when you moved here, you get, 5310, a pandemic, CARES. You're doing a great job. Thank you.
Thanks.
This group is already like wrangling cats. So now it's just like a cat circus. So good job. Does anybody else have anything for this meeting? Okay, I would just really ask that, as the county does have established communications, and so to send out stuff the items that come from the county, so it's consistent messaging across the community, and they're going to start doing Laura's communication regarding transportation, so that everybody gets the same message. And for anyone on the call, like if you're doing internal client transportation, that's fantastic. But if you have room and availability to help with the community, reach out to Laura, because we're never going to be able to serve the entire community. There's always going to be more need than there is capacity, especially with safer to ride guidelines. I think that's been my favorite part of the conversation with the county is like, why can't you put 14 people on a bus and bring them to us? And it's like, well, because we'll lose the ability to drive people from the state. So they don't really understand their safer to ride guidelines. And we can't just like round up seniors and haul them in. Otherwise, of course, that would be fantastic. But we're all having capacity issues. If you are not taking your populations to vaccine clinics, or you don't serve populations that are currently, 1B52 or whatever we're on right now, and like their parents or grandparents need a ride, then definitely refer to the transportation hotline, and Invita will be doling out those rides based on geographical locations to best serve clients. And Phil, do you want to plug that hotline number real quick? Because I don't know it off the top of my head.
Yeah, the number is 719-600-2221. It's pretty easy to remember. And yeah, I guess the last update I'll throw in as to how that's going. We were on all 3 news channels over the weekend, so we got quite a lot of free promotion for it, and we've been getting a ton of calls. So yeah, I don't think we can handle in-house everything we're getting, so we're happy to, I'm happy to let Laura take point on contacting who wants to help, but there's definitely a lot of rides out there because there's tons of vaccine events going on right now and continuing into the future.
And all 3 agencies are directing to Mountain Metro for people that are fully capable of riding public transit. Like, you don't just magically get a ride on one of our 3 agency vehicles because you call this magic number, and we're not Uber for fully capable people. So it is the same parameters as normal specialized transit, that if you are capable of riding fixed route, we're of course going to direct you to fixed route. And if you're a Mountain Mobility client, then we ask that you call Mobility. And then if you're 97 and in a wheelchair, of course, we will come pick you up from your home and take you. So I think that's a lot what Phil's going to have to deal with this week is lovely 60-year-olds that run marathons and do the incline every day that want, Silver Key to come pick them up and take them so they don't have to wait in line. And that is not the intent of specialized transit in the vaccine world.
One thing, Phil, I think for this, and this is to you, but this whole group, as we're seeing our capacity being stretched, that we're actually meeting this afternoon, me, Melissa, and Jody, to kind of figure out how we can spend the rest of our CARES Act funding, our first CARES Act funding. And so if there's an opportunity to help relieve something, then we need to know what that opportunity is. And Jody's going to raise your hand.
Well, I'm actually going to clarify that. We actually, the meeting today is not for current, it's for the future, because we have 2 more packages we've been alerted that we will likely be receiving. But much like the 5310 CARES side of the funding, we don't know how much, we don't know when, we don't know what the expiration date, and we don't know what the parameters will be. But we now know that we need to plan so that when it does show up, we can get it out to the community as soon as possible. So just so you all know, we are also looking at opportunities to try to find ways to expand the funding outside of contracted providers. And so we will be doing a lot of research into that as well. So just to make sure that that goes out to the community. So just a tiny clarification, but yeah, this 1.9 trillion Biden package could be a little more stress than blessing, but we don't know. We just don't know what the expectations are, what that amount of money could be. And that's specifically within the AAA Older Americans Act parameters. That doesn't even include what may be coming in specifically under transportation or other service provision to communities, counties, et cetera. So our conversation and planning is specifically what could be coming through the ACL, the Administration on Community Living, which oversees the Older Americans Act, and filters those funds down to our senior programs. So
Jody, when you guys meet to talk about the future funding, one thing I'd like to just put in your guys' brain is with that $1.9 trillion act, there's very likely chance that minimum wage is going up to $15 an hour. So if you guys could earmark that there's going to be a huge gap in all of our service contracts for some of our staff, especially direct service providers are not normally making that currently. So I think that there's going to have to be a buffer for agencies to cover that gap. We're lucky that we're in Colorado where our minimum wage is already 13 an hour, but there's some states out there whose minimum wage is still only $7 an hour. So they're going to have huge budget pitfalls where we're a lot more secure. But if you could think about like some payroll coverage gap for when that goes into effect. And when you guys are writing your AAA RFPs, make sure you are writing in your correct wages, because wages are going to look much different this coming year than they do right now. So, I mean, I think it's good. I like a livable wage, but, usually livable wage increases are not PS, like next month you have to pay your staff 2 times as much for some states. So we're very lucky we live in the state that we do.
Yeah, there is discussion at the state level through the organization that administers the funding to us through CDHS around how that's going to impact the overall funding for our standing contracts, because it does certainly play a role in what those CPUs and costs for services are going to look like. I have to jump off here and head to another meeting. So just a huge kudos to all of you for the collaborative efforts working with agencies that don't focus on or really understand the challenges that our clients have. And I appreciate every one of you who have been that voice of our seniors to make sure that we're asking the right questions, that we have consistent messaging, and just a huge thank you to each and every one of your agencies for doing the fantastic job that you're doing. And we're all in this together, and we're headed down a path we've never been before. So I'm glad we're on the same road together. So just keep up the good work, and we will catch you all soon. Thanks a bunch.
Thank you, Jody.
Thank you.
You bet.
So does anybody else have anything before we adjourn?
I just have one more thing. I met with Casta and from Casta, so I know yesterday we talked about, the fact that taking people to vaccination sites is a cost, and where does that funding come from? And obviously right now we have some funding through, AAA as well as through transportation to provide for that. But as we start moving through the phases, that's going to limit the availability of transportation to people, because specialized transit has its parameters of who they serve, and some of you guys have leveraged some funding to kind of expand your services through this. I know Envita has done that, but we had a great conversation about whether all transportation agencies are going to be called upon to help through the full phases of the vaccinations. And what does that look like? What would the funding look like? What could we advocate in terms of funding? So there has been a lot of CARES Act funding that has gone through CDOT that has been very broad in what you can use it for, which is great because we like broad money. It allows us to kind of move it around where we need it. But but also how do we incentivize and encourage agencies to help in this effort, and even have to, potentially expand their services to be able to help throughout the phases. Anne's interest, just because I know she knows a lot of the transportation agencies are being hit up to do a lot of different things right now. We also discussed they are going to have a spring conference in, I think it's March or April. And so we were talking through some topics that we thought would be important for that conference, and emergency management, and how do we connect with our emergency management people to better address these things as they before they happen, not during them happening. So we're working on some of those topics, and as we get the agenda set for that, I'll send that out to the group. And even if you're not a CASTA member, you can still go to the conference. And I think they're going to offer it both in person and virtually this year. So I'll keep y'all updated on that.
Yeah, just real quick, I think I'd like to explain where Envita is coming from in all of this. Because our reach is pretty broad, I think. We've already received a bunch of different CARES Act pieces to help fill different gaps. We have 5311 rural funding for rural El Paso County. We were in 5310. We're involved with the Office of Emergency Management to help with the isolation shelter within the city limits. We're involved with AAA. We're involved with Medicaid. Medicaid's had CARES Act stuff too. So all that to say, we've received all that, and we've also worked over the last year to build this framework of cooperation throughout the region. So our intent, I think, is to be able to simplify to the consumer. People don't care about that, right? They just want to ride. So, our intent with this hotline, but, in general, is to make it simple for people to get where they need to go. And if anybody here isn't already involved in that and they want to be, we're totally open to including new people. So reach out to Laura, reach out to me. We can fill you in on what's going on more specifically.
I like it. Keep it simple, stupid.
Yes. And Melissa, you had something?
Wanted to circle back to see if possibly Joe got his, is able to speak before we all sign off. So hoping maybe we might hear him if we try again.
I saw your mute button go off, Joe. So it looks like he unmuted. And earlier there was a green box around, but we still can't hear him. That was a great call, Melissa. Okay, Joe, we still can't hear you. So we're going to move you to the agenda for next month, Joe, because I do just find it absolutely fascinating to hear people's stories who are citizens at large on committees that at some organizations, you're voluntold to be on the committee. And so I really like to hear when people are very enthusiastic and join the committee without being voluntold. So I look forward to hearing your story, Joe. So with that, we will go ahead and wrap up, and hopefully with these vaccines by summer, we'll get to see each other in person someday again, even if it's at 6 feet apart. But I'm pretty sure next month we'll still be via Zoom. So we will see you here next month.